Hey, work from homers, Adam Schrader here. We love bringing you this podcast, and thousands of you have proven that it's been helpful for you. But since time and online storage space aren't free, Naresh and I wanted to come to you personally to ask for your financial support through Patreon. Go to patreon.com/workfromhomeshow and help support the show. And we appreciate your support at any amount you choose. That's patreon.com/workfromhomeshow. Thanks for your support. Let's get to the show.
Forced to work from home by your employer? Laid off or feeling depressed at home? Do you want to make money working from anywhere? We'll show you how to do it from your couch. It's time for another episode of the Work From Home Show. Coming to you from their homes in Austin, Texas and Tampa, Florida, here are your hosts, Adam and Naresh.
Hey everybody, welcome back to another episode of the Work From Home Show. Shout out to all our homies, homeboys, homegirls, home trans, and all the work from homers out there. I'm your host, Naresh Fisher, with Adam Schrader. Today we have internationally renowned Dr. Cynthia Fisher. She's the founder and chairman of Patients' Rights Advocate, PRA, the founder and former CEO of ViaCord, a leading umbilical cord stem cell banking service, co-founder and former president of the cellular medicine company ViaCell. It's just truly a pleasure to have Dr. Cynthia Fisher on the Work From Home Show. Welcome.
Thank you. It's a pleasure to be here today.
Yeah, well, part of the reason why I want to bring you on the show is because you're on the cutting edge when it comes to medical technology, med tech, as well as what's going on in healthcare today. You have the inside scoop. I believe you did some work with previous President Trump regarding some healthcare policy. So let's first start with the pandemic, post-pandemic, how much the medical industry changed and the future of telehealth. Is that here to stay? Because I hope it is.
It has been an amazing path forward that was catapulted as a silver lining from the pandemic to deliver care where we are through our devices, whether it be our mobile phone or our computers, to be able to have access, broad access to physicians all over the country through telehealth. Now, this had been, as you well know, pioneered. What the beauty in telehealth is that it gives broad access to patients. But also it gives an affordable way to get care. And I think what patientrightsadvocate.org has really focused on is giving patients access to care, but also access to information, and moreover, access to knowing the accurate and real prices before we get care. So across the healthcare system, telemedicine was pioneering before the pandemic. Employers were contracting telemedicine services to give access to their employees around the clock coverage for care from their homes. And these prices were price transparent and known before it got broadened into the hospital setting. So the hospital setting is now playing catch up. But I have great news for your listeners, because whether they get telemedicine or whether they get their care on site at a hospital, there's big news that happened this year. And that news is the Health and Human Services and the courts awarded the American consumers the right to know before we go the real prices in healthcare from hospitals. Starting January 1st of this year, hospitals were required to show their prices to us online so that we can shop for the best quality of care at the lowest price. Whether it be telemedicine, whether it be any kind of medicine from a hospital setting, we now have the right to know before we go. That's a huge change and a major shift in healthcare.
It's huge. And we did a previous episode earlier this year about, we touched on this specific policy, which I commend former President Trump with, because when he ran, this was one of the platforms that he ran on the first time I ever had a surgery as like a late teenager I was so shocked at how no one ever talked about pricing. You just had no idea until 3 weeks after the surgery, you get a big bill in the mail. And when I was, I guess, still a kid, I was like, how does this even work? Like, how is that even legal? It's almost cruel because you could easily rip off your customer. And now, as an adult and as a parent, I still see that when I go to the doctors and I get a bill 2 to 3 weeks later. And when I ask the business manager at the hospital or the practice, or I even ask the doctors themselves, they have no idea. I say, oh, how much is this going to cost? And like, oh, well, it depends. We have to talk to insurance and this and that. So we don't know. And I think this is a great step in the right direction when it comes to healthcare policy, healthcare law. And I hope it sticks. I truly do hope that it sticks.
This is an issue that 3 separate surveys showed that over 90% of Americans are totally unified on wanting hospitals and insurance companies to show accurate and real prices before we get care. And the great thing of what this past administration did is that they actually delivered on that, starting this year with hospitals. So wherever we go in a hospital, we have the right to know, the right to shop, and the right to save. And then next year, starting 2022 in January, insurance companies that cover us, 181 million people are covered by their employers or in the Obamacare network. So that means those individuals have the right to actually know the coverage. And the differences in the negotiated rates wherever we get care, even outside of the hospital system. So from everything from a chiropractor to imaging center for like an MRI or a lab getting a blood test, wherever we get coverage, we are to know the price and to see comparative prices of what that insurer is providing to other companies and other plans. That means we're going to know whether we're getting a fair price. And we, the consumer, will have the power to be able to be in control of our health decisions, as well as now our finances and our wealth decisions when it comes to healthcare, to be able to save our hard-earned money. Huge win for the American people. And as you say, we're very bullish that President Biden, as he takes the reins and continues on, he and Bernie Sanders wrote a manifesto on the unification of the party and the unification of their healthcare plan. And healthcare price transparency was right up there as one of the number one unifying issues. So when over 90% of Americans support wanting to change the game in healthcare by being empowered with this knowledge of being informed, we're pretty bullish that we believe very firmly that this next administration will honor what the American people want.
I would have to say, you're talking about 90% of people approving of that. I think that kind of shows that there's no hope of getting 100% approval of anything if 10% aren't behind transparency and prices. Does that cover, like, you go to the hospital and you're not just dealing with the hospital. Like, you get a surgery, you're getting billed by the hospital, you're getting billed by the anesthesia group, which is a very good chance it's just being contracted by the hospital. Does it include everything in transparency beforehand, or is it just services that the hospital employees provide?
Well, I'm glad you asked that. And come to think about it, look, 90% of people actually surveyed wanted. I would joke and say, were the other 10% hospital administrators?
That's what I was saying. They're the actual doctors, hospital administrators, lobbyists, etc.
Yeah, I mean, if you think about it, the only people that didn't want this was the hospitals themselves and the administrators of the hospitals and the American Hospital Association, which sued the American people and the American taxpayers because they wanted to keep gag orders to keep doctors in the dark, which you alluded to earlier, that oftentimes doctors don't know the prices because they were many times forced to sign a gag order to not tell a price, as well as insurance companies keeping it as secret. So they sued and they lost in the district court. And the great news is December 28th of 2020, the appellate court 3-judge panel, of which Merrick Garland, he was on that 3-judge panel, and we won hands down as the American consumers. to be able to have this right to know the accurate and real prices before we go. So to be really clear, we need to see clear prices. And hats off to the surgical centers around our country, like Texas Free Market Surgical. You can go online and look at their prices. Very easy to read, all bundled, all complete. So if you want to see a knee replacement or a hernia repair, you're going to get the entire price, including any radiology or anesthesiology, all in. Same with Oklahoma Surgical, same with Midland Surgical in South Carolina, and OSS Surgical, York, Pennsylvania. These types of centers came out being price transparent, one price, one patient, all patients. And they really changed the games. And now the hospitals have to show their discounted cash rates and all their negotiated rates in a digital form so that this information can be aggregated by a tech company. And you can imagine that soon we'll be able to shop all in, bundled in healthcare, just like we do for the airlines, for instance. And, Naresh and Adam, it's absolutely absurd that we never knew these prices to begin with. I mean,
Oh, yeah.
It's absurd.
The reason I was asking about that is my wife's a nurse anesthetist, and she's had multiple people, they've come back for a second surgery or something, and they've complained that, they're like, I got billed for my last surgery or, my last pain shot, and the facility is, in network, but the facility didn't tell me that the anesthesia department is out of network. So I got double bill
That
or
is
like
confusing.
in network for this, out of network for that, and it cost them $5,000 more than they thought it was going to. So that's really good to hear.
Absolutely. Right now, many are posting cost estimators online, these hospitals, and they're saying subject to change, right? These are not real prices, but they have to also post the actual prices. And those actual prices are in another digital format. We're looking for them, and we will highlight those hospitals that make it really easy for all patients to see easily what is that discounted cash price. So for instance, we know of a young woman in Boston who asked it. This was in 2020, so it was before this rule came about to have them actually post their prices. But when she did get the cash price, her entire surgery all in with the anesthesiologist, the radiologist, all in, around $11,200. $11,200 was the quote. She ended up going to her insurer. They couldn't give her anything as a price at the time. And after the fact, she found that the insurance, the same team in the same major hospital, the same facility, charged her insurance plan $58,000.
Oh yeah, the initial bill is ridiculous.
Right? So how is it that she got a better negotiated rate? She didn't. I mean, if you think about it, that comes out of her paycheck too, because she co-pays for that co-insurance, has a co-pay, but also it's coming out of her wages. Because, if the employer has to pay ever increasing rates of increased coverage, and the negotiated rate that the insurer is giving is far higher than the same surgical team would have taken cash by a factor of nearly 6 times, right? That's outrageous. So these are absurd price variations, and the only way we can drive them down is for us to actually know the lowest possible price we could pay and have innovative employers say, we'll pay directly with a debit card, that best price, and insure. Many will self-insure their plans and save the employee and themselves. That's a huge win for the American consumers of healthcare.
Yeah, I used to have one of these health share programs. You've probably heard of these health sharing programs. They work like insurance, and what they tell you is you go in and you tell the doctor or the business manager that you don't have insurance. So you're billed at the lowest rate possible. And then you send them the bill, the health sharing company, and then they pay the bill. And that's largely because, like you said, if you show your insurance, I don't know, maybe you can explain this a little bit more. But when you show your insurance, like in your example, it was a $12,000 procedure, but the insurance rate was $50-something thousand or $40-something thousand. It's astronomical, and it doesn't make it looks good on paper. Oh, I saved so much money. Like I've saved 95% off. But then you look at, like you said, what you're paying out of pocket and why is it so high to begin with. I had a good time. Now I'm also married to someone in the healthcare space. She's a physician at a hospital. And whenever a patient asks her about pricing, it's just go ask the front desk, go ask a business manager. But with regard to the health sharing programs, I don't know if you guys do any work with them. I had a good experience with them. I was just a little skeptical over the long haul. If something really bad happened, would they actually be able to pay what they say they can pay?
Mm. Well, oftentimes those health sharing plans do get a type of reinsurance too, and a policy to support their policy, so that they can pay for big catastrophic events too. So that's sort of their backup of the backup. But I think these are the type of innovative programs that are and plans that are really looking to reduce the costs of our care and our coverage. And price transparency in healthcare is the first foundation, right? We can see substantial innovation come into play once we have the ability to see prices just like we can in any other marketplace. And it'll be a big cure for the American public. And why is this? I mean, both of you are married to women in the healthcare arena, and you can appreciate that people have delayed their care. Before the pandemic, we saw data that people were fearful to go to the hospital before the pandemic because of fear of financial ruin.
Oh, absolutely,
so they put off going. And they actually put off going to the tune of over 64% of the people in this country surveyed. It was a 64% people said, yes, I delay because of fear of financial ruin. I fear having to pay something that I don't know whether or not I can afford. Because patients have been blind to no prices. We've been blindsided by those many times, outrageous bills, oftentimes overcharged. And even if it's fraud, because you never knew the price to begin with, patients have had horrific times trying to get bills remedied that were seemingly way overcharged and off kilter. And so the only way we can know and to be able to shop and benefit from competition across our country is to have this baseline of prices everywhere. And even when hospitals have merged and consolidated in a market and they're behaving like big bad monopolies, and prices have gone up inordinately, we can negotiate. In fact, we're so proud to hear of a woman in Atlanta, Georgia, who went on to Dr. Keith Smith's site at Oklahoma Surgical and found that the estimated price in the Atlanta hospital was $40,000 for her surgery, and she saw the same exact surgery for $3,600 at Oklahoma Surgical. Instead of flying to Oklahoma, she actually went to 2 hospitals in Atlanta, and she got one to match the $3,600 price.
That's amazing.
God bless her. I mean, obviously this was a planned surgery, but right now we're helping somebody who's going to get his gallbladder out. And they said, well, it'll be 4 to 6 weeks till we want to be able to take that gallbladder out. And so he's got some time to shop. And we're helping him do that in the Massachusetts market. We think this is a new beginning, a new world for consumers, and it's time to we have to work a little bit harder because this is new. It's a huge transition, but it will be a win for the American consumers.
Yeah, and as an offshoot of my previous statement about health sharing companies, just want for our listeners who are interested, I use a program called Liberty Health Share. And these health sharing companies, their basis, many of the rules come from the Bible or Christian principles. So you don't have to be Christian. I'm not Christian, but to stay on their plans, you need to follow certain tenets. Like you will not drink more than X amount per month. You will not, smoke more than this per month. You will try to exercise every day. You won't do drugs, which is stuff. This is all good for your health. I mean, you might be doing one of these vices, but over the long haul, it's going to be good for your health. And after I got married, then I went on my wife's insurance plan, so I left that. But it was overall a good, comparatively speaking, more affordable than Obamacare or any other insurance provider. But I also have a question for you, Dr. Fisher, and that is, you said, I think 64% of Americans are afraid to go to the doctor or the hospital because of the financial consequence. And that makes me wonder, if we pass a Medicare for all, wouldn't our hospital, because as is, the doctors are so busy, the hospital, at least in major cities, the practices, the hospitals, I mean, I had to wait 4 months just to see a urologist. And this is in the United States. We're not talking about Canada here. I have friends in Canada who have to wait 18 months just to see any doctor. So what are your thoughts about that? Okay, if we give or if people have more access to healthcare through, let's say, a Medicare for all or some other means, will that affect the ability to get in and get care and also quality of care? Because maybe now you have to hire more people who may not be as qualified.
Well, I think you raise a really interesting point, and we can only really know, at least from like our friends and neighbors in Canada, right? They're probably one of the best and closest examples to us. And we hear from many of these price transparent, discounted cash prices, price transparent, one price, one patient, all patients, centers, that they have a lot of Canadians flying to this country, even still in this pandemic, to more efficiently and more timely get their care, to get their hernia repaired or their gallbladder out or their orthopedic surgery. And they're paying cash to do that outside of their national health system. As we go, who knows, as we go as a country forward, whether we'll end up in a Medicare for all situation. I do believe that because 181 million people have coverage through a private system, no matter how we go forward as a country, there's going to be a huge transition if we do, and likely that we'll have two tiers, that we'd still have some level of private insurance perhaps in addition to, or private, maybe not private coverage, but private use of plans. I do believe firmly, from all the data that we've seen, that price discovery ushers in quality discovery. So people know how to shop, right? I mean, all of us shop for groceries, we shop for a car. Heck, I'll tell you, my daughter bought her first car, and we went online and we found actually the same exact model, the same exact price for $3,200 less, an hour and a half away from the town in which she lives. And she was willing to get in the car and drive an hour and a half, with a ride to go pick up that car to save $3,200. So I'm thinking, the nice thing is that we could see the actual price of that vehicle, right? It wasn't an estimate that wasn't real and came months or weeks later, right? And had surprises attached to it. We knew exactly what that was. So people's behavior, once we know that we can see these, and we will be able to shop for quality, we'll shop for what we believe is a fair price and a fair service that we can afford, and we'll be empowered to negotiate. And, then, God willing, those medical bills will match the prices that the hospitals quote us. Because, really important is that we have an actual price and the hospitals stand by that. And Adam and Naresh, there was a Journal of American Medicine Association article in 2019 that looked at the administrative waste in hospitals, just the administrative waste between our care and our billing. And 25% of all costs in a hospital are just pure administrative waste. So if hospitals and insurance companies have to compete, just like any other business, a grocery store or an airline or anybody, retail outlet competes for our business, you can imagine that we could get rid of that 25% waste and save, at least bring down those costs, and those can be passed on to the consumers. And that's how those successful surgical centers that are price transparent have even gone a step beyond, because they efficiently procure their staples and their screws for those orthopedic surgeries. They manage their costs, and they've been able to pass on those savings to the degree of 30 to 50% to the employers that go to the price transparent physicians and surgeons. So you can imagine how we could save in healthcare nearly 30 to 50% as a country. Well, that's north of $1 trillion in savings each year, because we're almost at $4 trillion a year that our country spends, all of us collectively, on healthcare. I mean, if you could save a quarter of that just on administrative waste, that's huge to rocket fuel for our economy and our families.
Well, you bring up a good point about the administrative waste, and that ties into technology. And I want to talk a little bit about whether you think more technology will be used to aid or even replace a lot of this administrative waste. And then also, are you familiar with blockchain and the role that blockchain is looking to play in hospital and healthcare administration?
Well, yes, and I think you're spot on the new frontier. And can you imagine too? Let's look at the future. Just now, the hospitals are having to post the actual data files of the discounted cash prices and the negotiated rates. Next year, we'll have the insurance negotiated rates. That means we're going to be able to shop for not only care at hospitals, and it will be able to shop wherever we get care, and we're going to be able to see how our plans are and shop eventually for plans. What does technology mean to that? Well, when we can see, like we can, the airlines like Expedia, Priceline, Orbitz, Kayak, these wonderful tools, or even look at TripAdvisor or Yelp, or these types of analytical tools that aggregate data and prices and quality and experiences. And when we consumers are empowered to actually comment to what the reality of our hip replacement was, or our knee surgeries and our outcomes, and those are all reported, you can imagine, as you can, that we're going to see on our mobile phones aggregators, and we'll be able to almost Uberize healthcare. Wouldn't it be great if the future, just right around the corner, looks like Uber, right? So that we could look at where we are in our GPS global positioning of where we are with our mobile phone and say, Adam, you need an MRI. Well, you could look at where could you go closest to get an MRI, who's available. They could pop up on your, like Uber, who's available to take you, and at what discounted cash price, what's your plan rate, and then what are the rates of the other plans they accept. Well, why wouldn't you get the discounted cash price and get your employer to just reimburse you, or your wife's employer, if you're on her plan, to reimburse you for the lowest price for that? And one could say, can you also think about after hours? So if those MRI centers have one person there nearly falling asleep between 1 a.m. and 5 a.m, that machine is already paid for. It's just incremental cost to them. So you could imagine these centers competing for our business in the middle of the night in the off hours. That makes healthcare accessible. It makes it also a form of wealth care because so many people, if we knew we could afford it, we would utilize our schedules to optimize what's in our bank account and savings and keep ourselves healthy. So we could have a much healthier American public and no longer have 64% delay care, but flip that to have more people go for care because they can actually shop very easily because of technology. And then you asked about Bitcoin. Not Bitcoin, blockchain.
Well, I mean, maybe Bitcoin too. Maybe.
Well, maybe we'll be paying for our healthcare with Bitcoin, and why not? Gosh, we should be able to pay with Venmo and get since the hospitals are getting paid right away, and they can get rid of all those middle players and administrators that are capitalizing on our misfortune. Just wipe them out. They'll get another job, right? The people that were at Blockbuster Video and the people that used to sell, VHRs or whatever, or CD-ROMs, they got new jobs. Technology moved on. So blockchain is another win for the American consumer because we should be in control of the access to our data. And blockchain gives us the keys to the kingdom of our information and can give us the keys to the kingdom of getting broad access, shared where we want it shared, and then timed out. Just like Find My Friends can time out. You can time out your friends. They could see you for 2 hours at a rock concert, and if you don't want them to find you after that, you can time it out. That should be when you go to the dentist or you go to a cardiac surgeon. They could see it for that day, but why do they need your records beyond that? And blockchain is also a new frontier that could be quite advantageous to empower the American consumer.
Yeah, I always thought, whenever going back to the waste issue you were talking about, is one of the things that I love about the Medicare for All idea is simply eliminating like the marketing budget that every company has to have, eliminating a lot of the paperwork that they have to do, and it just seems like it'd be a much more efficient machine in a lot of ways. But with all of the issues that have happened in the United States this year and the last year or so with the pandemic, the whole mask or no mask thing, do you trust the vaccine, do you not trust the vaccine, with both sides kind of looking at it in different ways, how have you seen patients kind of interacting with the healthcare system now? Is it less trustworthy or less trust in the system than there used to be, more trust? Kind of, what's your take on how people are viewing our healthcare system at the moment?
We've seen many consumers. We've done focus groups across the country, just listening. What is the consumer's experience with healthcare? What is their level of trust? And there is an inordinate amount of distrust. Unfortunately, it is because of this blind to know prices, blind to know what they're going to be charged, and being felt like blind sheep herded into the corral, right? That they can't even see
how I feel.
Where the fence line is. And the consumers that actually have said game over for hospitals keeping us in the dark, and thank goodness the courts ruled in our favor to rip off those blindfolds and make the hospitals have to disclose the prices. I mean, can you believe that I just can't believe during this pandemic they spent so much time and money and resources to sue to keep patients in the dark. So I mean, can you imagine if the grocery store did that and sued us to not show us the prices of our food? I mean,
I just imagine asking somebody, so what'd you do today? Oh, I tried to keep people from knowing what they're spending money on. It's like being that lawyer,
Right? And then adding insult to injury, not only do we get overcharged and price gouged, but then our credit gets affected when we can't pay those outrageous hundreds of thousands of dollar bills. I mean, people don't even know what the cost is to have a baby in this country, right? We found in the Boston market that there's one hospital in the Boston market, about 20 minutes outside of Boston, that you can have a baby for about $5,000, all in with the hospital fees, normal vaginal birth. Compare that to there are 3 hospitals in Boston proper. One of them charges $7,000. There's another one which would be like a tee shot away if you stood on a big tall tee and took out a big driver. That one charges $13,000, and then one of the biggest hospitals in Boston charges $45,000 for that same kind of birth, healthy, normal birth. And then we heard from a lawyer in Manhattan, her birth was over $120,000, normal, healthy vaginal birth. How can you go from $5,000 to $120,000 just to come home with a brand new baby, And her out of pocket was over $20,000 for that child.
That's insane.
Yeah.
Insane. She could have had 5 babies in that one hospital, at that price, for her out of pocket price. I mean, this is what's going to change. And it has to change, but we can no longer be sheep, and unfortunately, blind sheep, right? Blind sheep. And so the good news is we won in the courts. The bad news is we're going to have to fight hard to get the hospitals to tell us, and they have to tell us before we get that colonoscopy, before we get that MRI. And it's going to be key for your listeners to ask for the discounted cash prices, the lowest ones, not the funny money charge master prices, but the discounted cash, and then to get our negotiated rates. This is critical. but it's going to take a little bit more of us to fight it. But it's the beginning of an American revolution in healthcare, and that revolution is what the unified public is going to have now be empowered to change.
I just have to tell this story since you were talking about birth prices. Our first two kids were home births, and we had a midwife that we used, did all the prenatal visits, birth, post-birth care, all of that, $5,000 for everything. I tried to submit it to insurance. They wouldn't pay a single dime of it, even though we'd hit our deductible and other stuff. They wouldn't even discount it to a different price. Then we had our twins and went to the hospital for those two. And one of them went to the NICU, so his bill doesn't count. But the healthy birth came back, and the initial cost to them was like $45,000 or $40,000 or something. And, they negotiated it down to like, 15 or 13,000. And I got that bill and I was like, you jerks. 8 years ago, I had $5,000 for everything and you wouldn't pay me a dime, but you're willing to pay, $15,000 for my kid to be born in this hospital. And it was incredible to me to see what insurers were willing to pay for and what they weren't willing to pay for.
Yes. And then you can get billed by
shady.
It's unbelievable. And I've seen even NICU, a neonatologist visit, an hour neonatologist visit to a postman and his family, $80,000, and they didn't take insurance coverage from the Postal Service. I mean, really? $80,000 for an hour? My goodness, who's worth that? And the child was fine, but they were devastated with debt. And, these are worth fighting. And the way that your listeners can fight these bills is to ask for the itemized actual prices and the discounted cash prices and those rates. But I think the other big thing is the next step for us is when someone like you got the home birth all in at $5,000 and went to the insurer to reimburse it. If that employer is self-insured, it's worth going to your health plan administrator in your company and saying, look, I'm saving you tens of thousands of dollars through having this healthy birth at such a lower cost. It pays you to pay me to reimburse me at this because you are going to pay through the insurer. So I know it's an extra step, but once the employers go, oh my goodness, wow, you shopped. You saved us. This is going to help all of our employees, and we're going to be able to hire more people. We're going to be able to pay you more once we are able to lower these costs of coverage. So the only way we can get at it is if we all participate to shop, and then we all go and use our voices to show that this is a huge shift of empowerment and we are saving our employers. I mean, you can imagine if your employer was going to buy a new copy machine or a printer and got it at half the price, the same model of HP printer or whatever, of course they would reward you and thank you and for finding a way to procure the same thing at half the price or even a quarter of the price. And so we'd never put up with it. I'm just saying that employers would never put up with it in any other facet of purchasing or procurement in the business. And yet when we procure healthcare, too often we've been kind of deluded through these games of opacity and smokes and mirrors of the healthcare industrial complex, saying, oh, it's so complex, but it's really not. It's pretty simple to shop. We just needed to see the prices first.
To me, this is just, a lot of it is sick and disgusting, but you can probably talk a little bit. I saw a lot of headlines during the pandemic that hospitals were hurting financially because people were afraid to go to the hospital or they canceled their elective procedures. That makes me wonder, do you think the reason why this legislation was passed as far as price transparency goes is because the government stepped in and bailed out a lot of these hospitals during the CARES Act?
Well, the healthcare price transparency measures were actually in motion way before the pandemic. And then it took a comment period and time to put them into play. And then they were fought in the courts and they were won for the American consumers to know before we go. So that started this January. Let's talk about the hospitals during the CARES Act, CARE Act. CARE Act, excuse me. The hospitals were given a bailout to the tune of nearly $200 billion in taxpayer dollars. Those are direct taxpayer dollars. In addition, they got the PPE money, right? In addition. So there was a huge windfall for the hospitals that came as part of that government bailout. On top of it, people were funneled to hospitals through this pandemic. In many states, you had to go to a doctor or you had to go to a hospital to get the testing and to get care. So and to the big labs. So these sort of oligopolies won big time in this as a financial windfall. So it was really the patient that was harmed. Not only had we delayed through the pandemic of financial burden of being overcharged and price gouged all those years and delaying our care, like we talked earlier, about 64% delaying, but then we had the pandemic, which caused fear to go to the hospitals. But moreover, people are going back to the hospitals. We're hearing that there might be down in their regular care 20 to 30% in some way, but it's been made up, obviously, unfortunately, with some of the COVID patients. But the hospitals are doing just fine. And they certainly had plenty of money to support campaigns and do a lot of lobbying during this election cycle. Let's talk about that. I just read in today's press that the pharmaceutical industry and the hospital industry and the insurance industry, they're holding back paying to campaigns right now. Wow. It's almost like pay to play, and they're admitting it. They're being even transparent that they're going to hold back their political contributions. They can be transparent about that, but they don't want to be transparent about the prices they want to charge us.
Wow. Well, with the CARES Act, first off, that's a lot of money that you talked about. I did read, I'm not sure if this stat is accurate or not, but I did read somewhere that I think 3% of all hospitals filed for bankruptcy. They may not have necessarily shut down, maybe they did, but they filed for bankruptcy due to the lack of business they were getting during the months of March, April, May. Could have been extended even farther out. But the other thing is, under the CARES Act, I believe if hospitals were incentivized, not intentionally, but if they hospitalize a patient who had the SARS-CoV-2 virus, then they were paid $19,000 per patient. And if they intubated a patient with the virus, they were paid, I believe it was somewhere around $40,000 per patient. And so I don't know if you can talk about, I don't want to call it fraud, but unnecessary care that we may have seen in 2020, 2021, even before the pandemic. This could have been a thing. I know I personally had a family member who was fine, but he went to one of these suburban community hospitals that weren't as busy. And they said, we're going to have to keep you overnight. He didn't have really any breathing problems or anything, but he knew that he probably had the virus. And because of his age, he said, let me just go to a hospital. And I know the hospital my wife works at in downtown Tampa Bay, or right next to downtown Tampa Bay, they would not take a patient like that because they're too not overrun, but they're too busy. And they would just say, sorry, you got to stay at home. We don't have space for you.
Well, just as in any business, hospitals are a business, and the culture starts at the top, does it not? And that's systemic. And we will share with you that we've had so many people, even during this pandemic, go to tents put outside of emergency rooms for COVID testing. And this was more early on too, when testing was less readily available, but the hospitals would set up tents. And we had a school teacher, Carberry Campbell, down in Florida, DeLand, Florida, went to an emergency room tent, and she just went for a COVID test because she wanted to make sure she would be safe for students and her family. Again, not really necessary to get anything worked up, just wanted to make sure she was safe. And they ended up running chest x-rays, blood tests, strep tests, everything under the sun, racking up her bill, not just on a COVID test, but she had over $6,500 worth of charges, and then got the bill in the mail and said, your insurance isn't going to cover this. This is just for you. School teacher, $6,500. And she had to fight tooth and nail to say, wait a minute, I was told that the COVID test was going to be free. And you know what happened? Is after months of fighting it, they did say, yes, the government does give it free, and the COVID test was free, so we'll credit you $35 for the COVID test.
It reminds me of someone I know who went in for a knee pain issue and left the hospital a week later, similar to what you said, with having done a full body scan of tests. And nothing was found, nothing was wrong. But again, I said earlier, to me, a lot of this is just sick and disgusting.
Well, it's capitalizing on our misfortune or our ignorance, right? And when we won in the courts to see prices, the goal of that is to get not only a fair price, but also be treated fairly, that you're only getting the appropriate care for what you went to get resolved in your health, right? And so the only way we can change this game and is through the consumer empowerment. And, God bless us all. We won in the courts. This is our prize to be optimistic about the future of healthcare. And it's going to take every bit of us, each one of us, to be our own advocates. And today, unfortunately, when we go to a hospital, we can't even bring in oftentimes a family member as our advocate, right? We have to advocate ourselves. And that's difficult because we're there to get care and we're concerned for that. But it's game on to empower ourselves, but we're going to have to own it. And it's going to be a little bit harder this year because of the pandemic. But please know before you go, and you can say no if you think that you don't need an MRI or CT scan and you're feeling fine and you just wanted a COVID test, for instance. And treatment needs to be appropriate too. So once we have transparency in prices, then we have transparency in quality. We as consumers really should know, what is the standard operating procedure for a colonoscopy? What should I expect? It's a day visit. I shouldn't be held overnight. And if I am held overnight and there are complications and it's not my cause, then that hospital should be responsible and not charge me for medical error. A lot of people don't know that they don't need to pay if there was a medical error, right? I mean, in a restaurant, if we look at the menu and we picked a steak and we knew that we wanted the steak, we didn't want the expensive Wagyu beef and we didn't want the salmon, and we ordered the steak, and then we got the Wagyu beef that is, maybe 2 times more, or we got the salmon instead, we can say, hey, no, I didn't order that. You did that in error. And the restaurants, they oftentimes not only take back that meal, or they'll leave it on your plate and say, go ahead and eat it, but we won't charge you, right? We're not going to charge you for our mistake. The same applies for hospitals. I mean, gosh, even dishwashers have a lemon law, right, to protect the consumer. Why doesn't healthcare? And it's going to be up to us to make sure that we're not charged when there's a medical error, and we need to fight it because it's our right. It's our right to know before we go, and it's our right not to be overcharged.
Well, I think a big part of that is when it comes to medical error, they don't want to admit anything because then they're legally at fault. And we as people, a lot of people, like my wife, hears stories like Serena Williams, whenever she had her big issue when she had her birth, and my wife essentially said, it's most likely somebody in that delivery room messed up, and they, but people view it as they saved my life, not they almost killed me. A lot of times when it comes to medical error.
Right.
But how can people get involved? I mean, you talked about getting the hospital prices, 2022, getting the insurance prices, then kind of learning what each procedure has. What's coming next, and how do people get involved in it?
We knew that the Affordable Care Act was almost a misnomer, right? Because over the past 10 years since it's been in place, prices skyrocketed and coverage nearly double-digit growth each year. The great news is this price transparency and discovery, getting to know the accurate and real prices beforehand, is going to put all those trends in reverse. Now we should start to measure bringing down those costs. But the real thing that's coming is for us to be totally empowered is we have to pay attention and be in the know and demand to get it in writing. Get it in writing before we go from the hospital. What's the actual price going to be? And if you can negotiate, if you can get it at the cash price and you reveal that cash price to your employer, get them to sign off before you get that hernia repair that they'll reimburse you at that discounted rate. That's going to be a big win. So it's our time, and it's a wonderful time. I mean, this is the American revolution of healthcare. It's a wonderful time for all of us.
Yeah, now I want to talk a little bit about working from home, because we talked a little bit about telehealth, and I've noticed that more healthcare workers are working from home, psychiatrists, neurologists, even some hospitalists, infectious disease, nurse practitioners. So do you think that more and more healthcare workers are going to be working from home, or financially is that, I know you said the admin costs are so high, but financially maybe they can charge more if people are in the clinic, seeing people in person? What are your thoughts on this entire new work from home healthcare industry?
Well, God bless us all, because I'm going to tell you a case that we just fought. We're thrilled. We're thrilled that, even a dermatologist sometimes can treat patients from home with really good screen coverage, right? To be able to FaceTime or get access to the patient visually. And a lot of care can be done from home. Psychiatry, for one, access. Psychiatrists are very busy because their patients they can see readily from their home and treat them. That's significant for mental health care, especially in this time of anxiety with the pandemic. What we just fought just was absurdly outrageous and blew my mind is one of the patients that called in for a COVID test in a major city thought she was exposed because of people that lived in her house had COVID, and wanted to make sure, she was asymptomatic, just wanted to make sure that she could get a test. And in this state, they require a doctor's authorization for getting a test. She called in, said, is there going to be a charge where can I get a test? The doctor said, we don't have enough tests at the time available. You're healthy, you're young, stay home, quarantine for 14 days. And there's no charge for that. Well, weeks and months later, she got over $1,100 in charges, and the doctor's practice from that hospital, doctors that she didn't know, outbound called her and connected with her, and she was charged all sorts of charges, even a facilities fee and an office visit. Outbound, unsolicited calls. She said, well, I don't have COVID. I don't think I do. I just wanted a test. And we helped her fight those bills for over 4 months. We finally wrote letters to the CEO of the hospital, the CFO. We were going to report them to the inspector general because it was actual fraud. Because the hospital outbound called several times, 6 times, and reached her twice, and then charged her for every time she picked up her phone. Facility fees. I mean, this is fraud.
That is absurd.
Absurd. So as much as telemedicine was working better before the pandemic, less accessible, but at least those telemedicine services, you knew that when you called, your copay was $10 and your employer picked up $50, and you could get a dermatologist or a psychiatrist, or you could get somebody 24/7 who was in this national service that usually was conducted through a plan. Once hospitals opened up coming in, a lot of games were played. And we're hoping that with price transparency now and patients demanding to know before you ever have that dermatology appointment through telemedicine or online, that you get the actual accurate price, and then you put it in writing that I will not pay beyond the price of this visit telemedicine that I have agreed to, and you have told me that it is X price, and that's what I agree to, no more. So we have that power, but we're going to have to take the extra step to put it in an email before we get the care and make sure that the doctor agrees to that.
Well, that story you just told me, number one, I can't believe that's legal, because the business person in me is like, well, if I had a practice, like, a medical practice, I would just hire a customer service call center in India and just call a bunch of patients and rack up phone time and bill them for it without them even knowing.
Isn't that pathetic? I mean, that's sad. That's sad.
It's very sad. That I can't believe that was legal. That's insane.
It's not legal. It's not legal, but it was very difficult for that patient to fight the bill, and she got dunning notice after dunning notice, and the insurance company had to pay right away because there's state laws that they cannot delay payment to the hospitals. So her insurance coverage paid for their portion of it. So we're still working to get that money back for the employer from the hospital. Yeah. I mean, it's not over yet. And this is how owners, can you imagine how much time she had to take away from work to be able to fight this?
Most people just give up. They say, all right, I'm just going to save up and pay this bill because I don't want to get the lawyer, contact your PRA, your organization, and it's too much. The average person is going to be so daunted and they'll just give up.
Well, we look at how much time we spent. We put at least 3.5 days of a dedicated person, 3.5 days just working on it beyond what she worked on it on. So when we look at the time and the resource, you're right, but we fought it on principle. We just felt that this was fraud and the hospital needed to know that the fraud was being conducted. And if they didn't remedy it, we were going to report them to the Inspector General at Health and Human Services.
So tell us a little bit, Cynthia, about PRA, what your organization does, and also the impact you guys had during the previous administration and healthcare policy.
Well, yes, patientrightsadvocate.org, that's patientrightsadvocate.org, is really focused on bringing the voices of the American consumer forward to give us access to our health information and to give us the right to know accurate and real prices before we get care. And we also advocate and fight very hard to have a free market, a functional, competitive marketplace in healthcare, so that costs of both care and coverage can be greatly reduced through the empowered consumer. So we're looking to have Americans in health be much healthier, be able to go where and when they want, and to be able to have financial certainty to get a fair price and a price that they know they can afford. And so as we look at the last administration, we were so honored that at the highest levels, from the president to Secretary Azar to Secretary Scalia, across the board, they listened to patients. They listened to actual patients and brought them in. And then they also saw the solutions that we also helped bring forward, which is the surgical centers that were price transparent, and the doctors, that primary care docs that were price transparent, and how they lowered, and we brought employers in that directly contracted at these price transparent rates and lowered their costs by 30 to 50%. So we showed them that this was being done throughout the country in new ways, and saving substantially that everybody should be able to save. And the best thing is moving forward, we also helped fight in the courts. And we won in the courts when the hospitals sued to keep their prices secret with the insurance companies. And we believe that winning in the courts at the appellate level, where the consumer wins hands down, was also a shot across the bow to the insurance industry, which had rumblings of suing to not show us the negotiated rates when they have to next year. So this is a shot across the bow in favor of the American consumers to win this war. Then moving forward with the Biden administration coming in, we're just really grateful that President Biden and the likes of Bernie Sanders, who is looking for even a Medicare for All solution, and Biden looking at more perhaps a universal plan in the future, along with private insurance. No matter what, they embrace healthcare price transparency. And we see many states like Indiana coming on strong, Oklahoma coming on strong, looking to really push price transparency. So the free market works. We know it works. And patientrightsadvocate.org is really the voice. We're really a voice for the American consumers. And consumers are really not just us as the individual, because if healthcare affects our families, and it affects also, as consumers, our employers, and we as employees are payers. And then finally, every one of us who is a taxpayer. So this change, this American revolution through transparency in pricing, followed by quality, followed by every other facet, will greatly reduce the cost of care and coverage. And we couldn't work on anything better or more important right now as we're recovering from this pandemic, and we're recovering from the financial ruin that healthcare has put many Americans in.
Dr. Cynthia Fisher, founder and chairman of Patient Rights Advocate, PRA. The website is patientrightsadvocate.org. She's also the founder and former CEO of ViaCord, a leading umbilical cord blood stem cell banking service, co-founder and former president of the cellular medicine company ViaCell. ViaCord's website is viacord.com, viacord.com. Dr. Cynthia Fisher, thanks so much for joining us on the Work From Home Show. This has been a truly engaging, worthwhile, productive interview. I've learned a lot. It certainly does tie back to taking control of our health, taking control of our finances as we work from home. Do you have any final thoughts or anything else you want to promote?
Well, I'm overjoyed to share with you and your listeners this win for the American people of a victory to know the real prices in healthcare before we go. That's our right. Now it's up to us to exercise it so we can save into our wallets, our savings accounts, and our wages, and take care of our health at the same time.
Great. Dr. Cynthia Fisher, thanks so much for joining us once again. And to all our listeners, check us out at workfromhomeshow.com. Email us hello@workfromhomeshow.com if you have any questions, comments, concerns, thoughts about the interview we had with Dr. Cynthia Fisher. Subscribe to us on iTunes, TuneIn, Stitcher, Spotify, any other podcasting platform. We are everywhere. Leave us reviews there. Take a screenshot, send it to us at hello@workfromhomeshow.com, and we'll send you back something free and good. And until next time, keep on working from home.